Is our medical infrastructure failing us? Today we look at the national capital and beyond, how accident victims to cancer patients have failed to find critical care beds. A man who jumped out of the police van last week died after the police couldn't find any bed for him, not in one, but 4 hospitals in Delhi, according to a case that has come up before the Delhi High Court. The Delhi High Court, for that matter, has yet again asked some tough questions. If funds meant for Delhi's health infrastructure was being transferred to some other projects. Is this only about accident victims, though? Sadly, no. From what we've been able to find out, there have been umpteen cases. Delhi court said the onus is on the government to ensure the infrastructure could meet the population demand. Just the last month, a 14-year-old teenager died. She succumbed to cancer. Despite her family's desperate attempts as they try to get a critical care bed in 4 government hospitals, including Delhi State Cancer Institute, center-run Safdarjung Hospital and All India Institute of Medical Sciences. The family in desperation then uploaded the video showing the condition of their daughter. And this, many of you may remember, something that no parents would want to do. And then they got a bed in AIIMS. But it was too late. And this again is not the only case. Before we go any further, I'm being joined by the mother herself, Mrs. Razia. मैम, हमारे साथ जुड़े रहने के लिए, बनने के लिए बहुत शुक्रिया। आपकी बेटी के साथ क्या हुआ था और आप कितने हॉस्पिटल्स गए थे?
मैम, मेरे को ना पता चला था ये जून में पता चला था कि आपकी बेटी को ना टीबी की शिकायत है। तो तब ना मैंने अपनी बेटी को इंदिरा हॉस्पिटल में दिखाया था। उसके बाद फिर मैं कैंप हॉस्पिटल में गई, तो वहाँ से फिर मैं मेहरौली हॉस्पिटल में गई। मैं कम से कम 5-6 हॉस्पिटलों में घूमी हूँ मैम। सबसे पहले मेरी बेटी को टीबी ही बताई थी उन्होंने। उसके बाद वो बोले कि इसको हार्ट की प्रॉब्लम आ रही है, राजीव गांधी सुपर स्पेशलिस्ट में जाओ आप। मैं वहाँ गई तो उन्होंने मेरी बेटी का ऑपरेशन भी किया, कि उन्होंने मेरी बेटी का ऑपरेशन किया। उसके बावजूद भी मेरी बेटी की बीमारी हाथ नहीं आई। तब उन्होंने बताया कि हमने आपकी बेटी की जांच करी है, इसको ब्लड कैंसर आ रहा है। लास्ट में बताया था मैम मुझे, लेकिन जब उन्होंने बताया उसी दिन से मैं 25 तारीख से अपनी बेटी को ले के एम्स में सफदरजंग में जाती रही। लेकिन इन लोगों ने मेरी बेटी को कोई इलाज नहीं दिया, बार बार भगा देते थे। कहते थे बेड नहीं है, आईसीयू बेड नहीं है, हमारे पास आईसीयू बेड नहीं है, ये कह के भगा देते थे। कहते थे तुम लोग मुँह उठा के चले आते हो।
आप जब हॉस्पिटल गए, आप याद कीजिए, ध्यान से याद कीजिए, आपको क्या बताया गया?
मैम, मैं सोच के बता रही, मेरे तो सोच के क्या बताना मैम। मैं तो गई थी, उन्होंने मेरे से यही बोला कि बेड खाली नहीं है, यहाँ पे आईसीयू बेड खाली नहीं है। मेरे को यही बोल के भगा देते थे कि यहाँ पे आईसीयू बेड खाली नहीं है, तुम्हारी बच्ची का इलाज यहाँ नहीं होता। लेकिन मैं जहाँ भी जाती थी वो यही कहते थे आपकी बेटी का इलाज एम्स में ही होगा, आपकी बेटी को ब्लड कैंसर है। मेरी बेटी ने खुद उनसे कहा कि डॉक्टर साहब मुझे बेड दे दो, बेड दे दो।
आपको जब बोला गया एम्स पे जाने के लिए, आप फिर गए थे एम्स में?
मैं रोज एम्स में जाती थी मैम, मेरे पास पर्चा भी है वहाँ का बना हुआ। उन्होंने ये कह दिया कि यहाँ पे बेड खाली नहीं है। 1 तारीख को उन्होंने पर्चा बनाया भी मेरी बेटी का, थोड़ी देर देख के 10-5 मिनट कह दिया यहाँ पे बेड खाली नहीं है, आप कहीं पे भी जाओ। उन्होंने मुझे रेफर लिख के दे दी, नहीं लिया उन्होंने मेरी बेटी को। मैंने लगातार 10 दिन तक चक्कर काटे वहाँ पे। रोज जाती थी मैं, सुबह में, रात में वापिस आती थी।
फिर आपको एम्स में बेड कैसे मिला?
जी, वो मैंने अपनी एक वीडियो वायरल कराई थी। मैंने अपनी एक वीडियो वायरल करी थी, तब हिंदुस्तान पेपर वालों का फ़ोन आया मेरे पास। वो बोले कि आप सुबह चले जाना, आपको एडमिट कर लेंगे, आप हमें वहाँ मिलना। जब मैं वहाँ गई तब उन्होंने मेरी बेटी को एडमिट कराया। उसी दिन उन्होंने शाम को मृत्यु घोषित कर दिया। मैम, मेरी बेटी को सुबह में एडमिट करा था 11-11:30 बजे, और शाम को 5:15 बजे वो बोलते कि आपकी बेटी ख़त्म हो गई। मैम, मेरी बेटी अच्छी खासी थी, वो बार बार कह रही थी मेरे को इतना हैवी ऑक्सीजन मत दो, मेरे को इतना हैवी ऑक्सीजन मत दो। उन्होंने फुल ऑक्सीजन दे रखा था उसको, मेरी बेटी को। मेरी बेटी बार बार कह रही थी डॉक्टर साहब मुझे सिर्फ 2 किलो ऑक्सीजन की ज़रूरत है, और वो बहुत ज़्यादा ऑक्सीजन दे रहे थे मेरी बेटी को। वो बार बार कह रही, वो कह रहा है कि आप डॉक्टर हो या हम डॉक्टर हैं, लेकिन उन्होंने मेरी बेटी का ऑक्सीजन कम नहीं करा। मैं, मेरी बच्ची तड़पती रही, कहती रही कि मेरा दम घुट रहा, मेरा दम घुट रहा, लेकिन उन्होंने मेरी बेटी का ऑक्सीजन कम नहीं करा।
नहीं, वो तो मेडिकल है, उसमें हम नहीं जा रहे हैं अभी। वो हमारा वो तो मेडिकल डॉक्टर्स और ट्रीटमेंट के ऊपर है, उसके ऊपर हम फोकस नहीं कर रहे हैं, लेकिन मैम शुक्रिया आप हमारे साथ बने रहे।
मैं चाहती हूँ मैम मेरी बेटी को इंसाफ मिले, और जो मेरे साथ हुआ मेरी बेटी के साथ हुआ, वो किसी और के साथ ना हो। मैं अपनी बेटी के लिए पूरा इंसाफ चाहती हूँ। मेरी बेटी को इंसाफ मिलना चाहिए।
जी शुक्रिया मैम, शुक्रिया आप हमारे साथ जुड़ी। Now, it's heartbreaking, and of course, it's been an emotional course for the family. This happened just in December. They've possibly not even had enough time to heal enough. But what I do want to take out of what she has said, and we're not getting into the treatment procedure because that is something which is within the purview of the doctors. What we're really looking at is her version of how she had to go from hospital to hospital trying to find a bed. And she's just one case. We even have more relatives who will be speaking to us in due course. Now, let me straight introduce my panel to you. I'm being joined by Dr. Sanjay Sood, who's the CMO for Safdarjung Hospital. Dr. M. Wali, who is the former honorary physician to the President of India. Dr. J.A. Jailal, former national president, IMA, as well as Dr. Satish Prasad Rath, Dr. Scientist, founder, Santaan Skids. Thank you very much, all four of you, for joining us. We deeply appreciate it, and we do hope that our focus would highlight some of the things that need to change and also bring out what's been changing. Thank you very much. But my first question, Dr. Sanjay Sood, to you is, you heard what this mother said, and she also mentioned about Safdarjung Hospital. But again, what I'm trying to reiterate it's a struggle for so many people, even in the national capital, to just get a bed for critical care. Video went viral, then she gets a bed. Court has asked, why are accident patients or critical patients not getting beds in the national capital?
Good evening. What a great question. See, the question what you're raising today is about medical infrastructure, and I think the viewers should know the WHO recommends about 3 beds per 1,000 population, and maybe about 10% of as ICU beds. And in Delhi has about 2.7 beds per 1,000 population, but India has a different ratio, 1.3 per 1,000. So the question is, you are sitting in the heart of the capital. The hospitals in the capital cater not only to the population of Delhi, in fact, they cater to the whole of North India. ICU or critical care has become extremely expensive, but it has become extremely expensive, and affordability in the private sector is very less. So everybody rushes to Delhi and they all want to go to the government hospitals. They have faith. As far as my hospital is concerned, we don't have any refusal policy, but we have really increased our infrastructure in the last few years of critical beds. But the basic question is, there is huge rush from the peripheral areas, and unless you strengthen the peripheral areas or the peripheral hospitals, things are very difficult for Delhi. In fact, why I'm saying health is a state subject. It's not a central subject. So you need to really develop the peripheral system so that the systems, Delhi hospital beds are able to cater to the hospital patients of Delhi. And the things are not so bad in Delhi, but it is a rush which is coming from the peripheral areas, which is causing a lot of problems for us.
Dr. Sood, but this is expected. It is the national capital. People from across India are going to come to the national capital. National capital is supposed to have some of the best health infrastructure, at least government infrastructure should be the best. Whether it is or not could be a point of concern. But let me just quickly get introductory remarks from others as well. Dr. J. Jailal, who's a former national president for IMA, thank you for joining us. But very quickly, is this a Delhi problem? Or is this a problem across India? Is
Yeah,
the money
indeed,
being
it is a
used the right
problem across.
place?
Indeed, it is a problem across India. Not only, I mean, India is one country. Even after the COVID, we have not learned that we need to give more importance to the public health and invest on more on the public health aspect. The need, what we need, as per the statistics, what he has said, the 3 beds for 1,000 population, we need another 2.4 million beds. That is 24 lakhs beds needs. India is at a shortage in the overall level. If you see the healthcare indices of India, though we are doing a lot of good things in the in special sectors, but on the availability of the hospital bed, we are in a very low level. Even comparing with Bangladesh, we have a less beds. We are at the 157th list of 168 countries level. So this is a time that many times we are insisting on that. The reason for this is the government is not spending more money on the public health. The GDP, the budget, if you see, it is always 1.1% of the GDP. And comparing with all the other countries, it is must be 4%, 5% of the GDP. And unless the government is willing to come forward and spend more on the budget on the GDP, or at least 2.5% to 3%, this problem is not going to solve. And this is a ramping problem. This is a real concern which we are giving with the
Right.
aging population, health awareness, people with NCD diseases. This is going to be mount again, and it's going to be a big challenge for us in the days to come also.
Right. Mr. Wadley, would you want to respond to, Mr. Wali, would you want to respond to this? Health, the money that is being spent, the budget that is being allotted for the healthcare, that may be less, but is the money being used the right way? One of the questions which is being asked by the court as well. I understand that it's not for you to respond, but from your long practice, do you see enough being invested in hospitals to strengthen what needs to ensure that critical beds are allowed, are available for patients?
Thank you. First of all,
Dr.
I
Wali,
wish
if you
all
can
the
hear me?
viewers a
Yes,
happy
please.
new year with these two serious and tragic notes we are discussing. With these two tragic notes, we have just started this news bulletin with. I'm wishing every one of the viewers and you a very happy new year, and with a hope that we will improve this long-standing problem. I must say, I'm reminded of one constant sentence which one of my presidents, who is no more alive, used to say in all his speeches: India has made enough progress, but its progress is being diluted by explosion of population. This is one factor. Second is, yes, GDP is inadequate. Third is, yes, it is funds can be changed towards the immediate care. This is very important, that we should rightly distribute the funds which are for the development of the hospitals. I would say still, with this kind of scenario, Indian healthcare is one of the best in the world, and our doctors are one of the best in the world. We never refuse patients in government hospital. It is sometimes by the security or some other agency that a patient who is entering in an ambulance, these are not able to reach to the doctor. Once the patient enters the hospital and reaches to the doctor, this patient will never be refused. You must have been hearing and showing at times that we have 2 patients, 3 patients on one bed. This scenario is happening only because we never refuse patients. So this is wrong to say a patient is being refused from the hospital on the pretext that bed is not available. Yes, we are very much short of beds in intensive care, critical care, and sometimes even emergency beds are loaded. But normally we do not refuse, as my first colleague has said, we never refuse
Dr.
the
M. Wali, I'm
patients,
sorry, let
and
me
no
just
patient
interrupt you
dies
at this
due to
point.
bed. Patient may die due to the nature of disease. Yes.
Dr. Jailal, it's hard to believe that patients will not be refused from government hospital, because while you may say that they may not be refused, the problem is many are not getting access to these government hospitals. Before I go to others also, let me get in Dr. Satish Prasad Rath. Would you be able to tell us, at least the last year's record shows that 9 government hospitals in Delhi don't have ICU facilities. Would that be still the current status? Is it as dismal as this?
It is actually. So we need to bite the bullet. We need to understand the truth. So we are severely undercapacitated when it comes to the bed ratio per patient population, and it is acutely short when it comes to the metros. So Delhi is like, one more country. So same is the situation in all the metros, where I think, people really struggle to get into a bed. But I will try to, let's say, suggest few, solutions, how we can get into this. We do also have a problem of citizen awareness, citizen participation. We do see the model in Kerala and most of the South Indian states where people, demand for healthcare. They utilize all the primary care systems, which is available in their vicinity. At least people are aware that, if they fall down, if they break their bone, or if they have got a fever, or if they have got a cancer, where they will go to. Unfortunately, in the northern part of India, we don't have this situation. So because citizen awareness and participation is not there, so it doesn't become a political, let's say, campaign. When it doesn't become a political campaign, definitely the government is not going to give priority in budget for this. So we are underspending for this, and this is an implication that we don't have enough bed. But the government has done also something which is very good, which is Ayushman Bharat. So government is giving money in terms of Ayushman Bharat to the needy, that you can go to not only public hospitals, but also you can go to private hospitals. Now, what government can actually do much
Fair
more,
enough.
to increase the beds is it can encourage the private, let's say, players to build more capacity, because building it from the government side is going to take time. So private people can be encouraged, one door, open policy that, if I'm a doctor, I want to be an entrepreneur, I want to create, let's say, 10 critical beds. It should be easy for them for, financing as well as, a specialized loan, so that,
Okay.
they are able to
All right.
create capacity. So capacity can only be provided by government plus, let's say, private players. And the most important part is, even if, whatever
Dr.
we have,
Satish?
we are not utilizing it properly. So there is a system in public health system called triage. So every person should not be going to AIMS or, let's say, Safdarjung, which is a challenge, which a reputed hospitals like Safdarjung or AIMS are always going
No,
to face.
Dr.
So if I'm
Satish,
having a disease,
sorry,
I
let me
should
just
have a
interrupt you.
software
We are not
system.
talking about
Yeah.
every patient going to these critical hospitals, because we are talking about patients who really require critical care and are not getting
Absolutely.
access to critical
So-
care. So we are talking about critical care patients. But allow me to interrupt.
Yeah.
We earlier today spoke to a grandfather, Rizwan Ahmed, who lost his one-day-old granddaughter in 2017 because no government hospital could give him a critical care bed for his one-day-old granddaughter. Remember, that's what we're talking about. These are difficult truths, and we're just trying to bring them out. I'm being joined by Rizwan Ahmed. We spoke to Rizwan Ahmed earlier. रिजवान जी, आप हमें बताएं, अभी हाई कोर्ट ने कहा है कि दिल्ली हॉस्पिटल्स में हमारे पास लोग एडमिट करने के लिए मुश्किल हो रहा है, जगह नहीं है. आपके साथ क्या हुआ था?
हाँ, मेरा नाम रिजवान अहमद है. मैं श्री राम कॉलोनी खजूरी में रहता हूँ, पूर्वी दिल्ली नॉर्थ ईस्ट में. और मेरी पोती जग परवेज चंद्र हॉस्पिटल शास्त्री पार्क में पैदा हुई थी और उसको सांस की प्रॉब्लम थी और डॉक्टरों ने ये कह दिया था कि हमारे पास ये मशीन नहीं है और इसको ऑक्सीजन की ज़रूरत है. आपको मैं लिख के भेज देता हूँ, जीटीबी में चले जाइए, एडमिट करा दीजिए, और चाचा नेहरू में चले जाइए, या तो आप वहाँ चले जाइए, क्या कहते हैं, ये जयप्रकाश नारायण हॉस्पिटल जो एरबिन हॉस्पिटल है. मैं जब वहाँ पहले एरबिन हॉस्पिटल गया तो वहाँ पे डॉक्टरों ने मना कर दिया, बोले मेरे पास बेड खाली नहीं है. मैं फिर 1 घंटे 2 घंटे बाद वहाँ पहुँचा जीटीबी हॉस्पिटल, तो गुरु तेग बहादुर हॉस्पिटल में, तो उन्होंने भी यही कहा कि हमारे पास जगह नहीं है. बहुत परेशान होने के बाद मैं सुबह से लेकर शाम तक जब परेशान होकर के चाचा नेहरू में गया, तो मैं वहाँ पे गया तो उन्होंने कहा बेड तो खाली है, आप थोड़ी देर इंतज़ार करिए. मैंने कहा आप मुझे कह दीजिए तो मैं बच्ची को लेकर के आऊँगा, क्योंकि आईसीयू का मैटर है. तो वहाँ के जो डॉक्टर निकले उन्होंने हमारे साथ बिहेवियर अच्छा नहीं करा, मेरे साथ धक्का मुक्की करी. जो वहाँ के गार्ड थे उन्होंने अंदर जाने नहीं दिया. जो मैं पर्चा दिखा रहा था उनको, लेकिन उसके बावजूद भी बड़ी बदतमीजी के साथ गाली गलौज करके मुझे बाहर धक्का मार के निकाल दिया था.
आपने कितने हॉस्पिटल्स के चक्कर लगाए थे?
जैसे हमें बताया गया कि जीटीबी जाइए, तो पहले मैं एरबिन हॉस्पिटल गया, लोकनायक जयप्रकाश हॉस्पिटल गया, वहाँ नहीं मिला. तो मैं 1 घंटा 1.5 घंटे बाद मैं जीटीबी गया. जीटीबी में भी वहाँ से फिर मैं भागा चाचा नेहरू हॉस्पिटल. चाचा नेहरू गीता कॉलोनी में है जो, वहाँ पे जब मैं गया तो वहाँ पे हमें काफ़ी देर इंतज़ार करना पड़ा, गार्ड अंदर जाने नहीं दिया. फिर मैं डॉक्टर से बात करा, उनको मैंने वो पर्चा दिखाया ट्रांसफ़र का, उन्होंने पर्चा लिया और फाड़ने जा रहे थे, कह रहे मेरे पास जगह नहीं है, मैं कैसे आपको करूं, हमारे पास और भी काम करना, मैं आपका नौकर हूं, वगैरह वगैरह। उन्होंने मुझे धक्के मार के वहाँ से भगाया था, बहुत बदतमीजी की थी हमारे को चाचा नेहरू वालों ने।
बच्ची के साथ उस समय बच्ची के साथ क्या हो रहा था? बच्ची कहाँ थी?
ना, वो तो उसी टाइम रात को ही ख़त्म हो गई थी। जब हम वापस आए कहीं नहीं मिला तो निराश होकर के हम तो हॉस्पिटल आए, वो बच्ची ख़त्म हो गई। क्योंकि वहाँ पे पंपिंग करने के लिए डॉक्टर जो नर्स थी उन्होंने भी उनके पास कह रहे नहीं, आप अपने परिवार के किसी को बताइए, ये हाथ से मतलब बॉलिंग करके हाँ इसको ऑक्सीजन देना पड़ेगा। तो हमसे जितना हुआ हमने करे। फिर भोर में सुबह बच्ची पैदा हुई थी, रात पूरा दिन और पूरे रात में भोर में बच्ची ख़त्म हो गई।
और जिन भी सरकारी हॉस्पिटल में गए थे आप, जहां पे वो भर्ती थी, वहां पे उनको मशीन नहीं मिला, वो उनको डॉक्टर्स देख नहीं पाए?
नहीं, वहाँ मशीन नहीं मिला। वो जो एक पंप आता है हाथ से बॉलिंग करके, इसको आप ऑक्सीजन दीजिए, जब तक हम हमारे घर के जो भी लोग रहे उसे करते रहे। उनके पास कह रहे हमारे पास ये सुविधा नहीं है, आप जीटीबी चले जाओ, आप या तो चले जाइए वहाँ क्या कहते हैं अरविंद हॉस्पिटल, लोकनायक जयप्रकाश हॉस्पिटल, या आप चाचा नेहरू। तो वहाँ पे हमें कहीं भी बेड नहीं मिला था। वो बच्ची ख़त्म हो गई थी पूरे दिन भागने के बाद। फिर पूरी रात सुबह भोर में 4 बजे बच्ची ख़त्म हो गई थी वो हमारी।
Right. We spoke to Mr. Rizwan earlier, and tragic details, of course, coming out in this particular case. He had spoken many more things as well. But Dr. Sanjay Sood, an important aspect of what's really coming out, one is the inaccess. But second part, remember, a lot to do with violence in hospitals against doctors and many times the patients also at receiving ends. It has a lot to do with just the insufficient infrastructure. So it's not just the patients, it's also doctors at the receiving end. There was a committee which was set up by the court, and the committee told at the heart of the violence against doctors, the main issue really is poor infrastructure, incapability to handle the burden.
You got a great question. See, please understand, last 10 years, after the new government came in 2015, first I'd like to correct one thing. Our health budget has really gone up from 1.2 or 1.3 to about 2.1 currently, and it was even 2.1% of GDP last year, and it amounts to about 89,000 crores annually. US spends $4 trillion on its health budget, but its COVID care was not a very great thing to be boasted of. So money is not everything. So one is the health budget is over the last 10 years is repeatedly being increased. Secondly, India's health care is not only among the best, it is among the cheapest in the world. Please, we have to even consider that. So question is, we are gradually, and again your defense budget is about somewhere around 13.7%. So a lot of money is going for defense, whatever you may say, the kind of neighbors we have. So huge money is being taken over by defense, and the way health infrastructure is being developed by the central government, you will be amazed. 19 to 2012, there are about 6 aims. Health is a state subject, so center is going to, they have now 25 aims. So 25 aims, you just look at the transition we are going through in the system. But people's expectations are very high, and there is nothing wrong about it. But unless we strengthen our peripheral infrastructure also, not only focusing on the bigger hospital, they are doing their best. And second question is the violence. There is huge overcrowding. Patients are being referred right, left and center to the bigger hospitals. Maybe the patients also have that brand value with the patients is there of those hospitals. So instead of rushing to those bigger hospitals, if we start developing our smaller hospitals at the peripheries and outside Delhi in the nearby regions, we'll be doing a much better job. But things take time, but there is no doubt the way government is moving, the health infrastructure. You see, if you go to England, I came across a guy, if you want to have an oncology consultation, you need to wait for 12 weeks. I came across a person in the US, he had to add urine culture sensitivity done, a long appointment was given. But in India, you can have both the private and the government sector. If you go to a clinic and you have an oncology department.
So, but in the government sector also, you have people who have been waiting for a very long time in lines outside. It's not like you have very immediate referral. You may, if you have money, you can go and get yourself checked up. Outside governments, either you don't have a system which is functioning, it has collapsed at some level, whether it be at the tertiary sector, primary sector, whatsoever. Either it is not there, they will refer you to a private lab, the private lab will charge you. So the government system is not there. Otherwise, you're just waiting outside the government hospital day in and day out for even an appointment for whatever reason. So it's, I mean, you know, if you want to compare, I have the other side to tell you, sir.
So what he said was, one of the sirs said before, there is a huge population burden. See, you look at the population of Delhi, you have a huge floating population. You have 2.34 crore people in the city of Delhi.
Let me just get in others, sir. Dr. Jailal, whatever we are discussing, unfortunately, is not new. This has been in the public domain. This is so much spoken about. Even you go to a common ordinary citizen, they will be talking about this. You go to any government hospital outside, they will talk about how many times they've had to come back to the hospital to get a referral, to get a doctor's appointment. The blame culture apart, my question is, if you look at the current data, we have 1,396 ICU beds out of 11,473 beds in the national capital. I don't know what the national picture is. Why isn't this changing? Why aren't we on war footing, considering we have even battled a COVID pandemic? Why does the court have to ask these questions? Imagine police could not get a bed for a man who jumped out of their police van. So what will you talk about an ordinary citizen?
Yeah, I absolutely agree with you, because most of the time it is only the knee-jerk reaction we do, and whenever it is emergency need, we put 3-4 beds and say that is ICU bed we are increasing. But there is no systematic increase in the ICU beds. It is not only the beds. When we talk about the beds, it needs all the infrastructure, manpower. There must be adequate paramedical personnel must be there. That's how we are going to increase the bed. For an ICU bed to be increased, it is a huge investment also. But that is not happening. Just in the ICU of the 5 beds, if you add
what is the problem,
beds,
sir? India generates, the state that you come from has one of the most specialist nurses, has the nurses which are best world across. Kerala is famous for them. Not just Kerala, several other states as well. You have some of the best minds, best brains, best training in India. You cannot retain them. You're not paying them. What is the problem? Where is the solution to this?
No. This is a real problem which we are facing, because every time we are talking, even the people who are in the power always try to give a wrong statistics also. That is a very painful one, saying that 2.1% of the GDP is used. Absolutely no, we are ready to challenge that, because you are increasing the quantity of the money. That is not in corresponds to the GDP percentage. That is what we are saying. Second, in the infrastructure development, they are saying only on talking about the increase the number of medical students. More medical colleges are being coming, more medical students are being 108,000 medical students are being created. That is not going to solve the problem of the healthcare needs of the India. What the healthcare needs of the India needs dedicated, systematically organized and critical care beds, and the hospital beds needs to be produced. See, now we are talking about Ayushman Bharat. It is very painful to see, even otherwise, even before Ayushman Bharat, a patient who is going to get a treatment in government hospital is free, absolutely free. Because India is talking about, it is a fundamental right of a government, fundamental duty of the government to give the treatment to the people. But now it is a gimmick is happening. The same amount of money which you are giving free treatment in a government hospital, they are saying that we are giving an insurance for them. When you are going for the Ayushman Bharat scheme, your patient getting treatment in the government hospital is going to be given compensated by an insurance. And this is just cheating the public. Instead of that, the entire money, if they are going to create new beds, new hospital, all the existing hospitals to be revamped, then absolutely there will be a lot of change should have been taking place. But now, having said that, unless we going to make some systematic implementation, like making health as a fundamental right of a citizen, making the healthcare system as a family medicine system or a 3-tier system, not all the people directly go to the super specialty hospital, they go through the primary care system, secondary system, then tertiary care system. And as we talk about the more and more population, more and more health awareness, the penetration of the adequate healthcare insurance system should also reach the people so that they will be able to get the treatment from the private sector also. 60% of the healthcare needs of the country is met by private sector, not by public health sector. When the government is not taking care of the private health sector, not giving importance to that, not giving incentives to for the people to build the healthcare infrastructure, and that is going to be a big problem. I wholeheartedly appeal and request the government, please understand, already we had a COVID aftermath. Now again another issue has come in. Now the government should come out and come forward to make a systematic improvement in our government health system. Otherwise, just a knee-jerk reaction is not going to solve this problem.
Okay. Dr. Sanjay, so do you want to respond to this? Population control and burden of healthcare really are two different aspects. They may not be disconnected, but you cannot give the excuse of inaccess to healthcare on population control or lack of population control. I mean, I don't know. Does this stand the test?
I actually agree with what you're saying. Population control is okay, one small part of the story. We have to, like women you said, the women, see, very simple solution. One of the biggest problems for morbidity or illnesses in the country has a very simple solution: anemia. Anemia, if the hemoglobin is checked at the peripheral levels and iron tablets are prescribed, that so many illnesses can be prevented. So question is, health awareness through the media can make a huge difference, because see,
And there are states that have really proved the strength of their primary healthcare center. I come from a state which has brilliant primary healthcare center. There are other states in India as well.
So question is, if you have good primary healthcare center, you have a good secondary healthcare center, you'll have less of toxicity. No, everybody has to die one day. So that is unavoidable. But the question is, infrastructure development is going on at a rapid pace. Suddenly in one day things can't change. Money is being increased, and a lot of emphasis has to be given to preventive medicine, which is the thing of the day. And a lot of problems, people will stop moving to the main central government hospitals. And if you like, in the periphery of the Delhi, if you have some good big hospitals with good infrastructure, with a lot of things will change. But India, it's taking a little time, but things are moving.
We are totally out of time, but one thing remains for sure. India doesn't have an excuse in 2024 for inaccess to medical health care, to critical care. And India does not have an excuse for not strengthening its primary health care, which is failing in many parts of India, but succeeding in some. States will have to look into this. Center will have to look into this. And hopefully, 2024, as we gear up for one of the biggest elections in India, this will become a huge political rallying point. It's up to the citizens like you and me to make this a reality. Thank you very much, doctors, for joining us on this.